on that. I am going to, when my slides pop up in a second, use a briefer window of time to give you guys just sort of an update on what the GVRC has been up to over the past year. This day is largely about individual presentations on specific studies, but I also thought it would be useful to have a little bit of sort of a higher up overview of what we do in any given year. And so I'm going to launch into that. I do have to quickly just put a disclaimer up. Some of the work I discuss or I'm about to discuss is covered or was funded by the Department of Defense through the Military Suicide Research Consortium. So just, opinions are mine and not DOD's. Okay, so the question is, what have we been up to during this fiscal year that this event is meant to sort of celebrate and discuss? And the answer is actually a lot. But the thing I wanted to highlight first actually is that our team has grown. And a voice that's absent today, not because we wanted to be, but because his family has a big event today, and we're a very sort of family-focused group, and so he's where he needs to be right now. But Dr. Dan Semenza joined our team this year as Director of Interpersonal Gun Violence Research. I mentioned earlier during my opening remarks, I'm a suicide researcher, and most of the findings I'm going to discuss in a couple of minutes are suicide focused. Dr. Semenza brings a balance into our center to make sure that we have expertise across the board to the extent that anybody can have that. And his contribution has been enormous. And so I didn't want his voice and his work to be absent. And so I want to take a second and highlight a few of the things that Dan has been up to over the past year. And there's lots of studies he's doing and mentorship and all sorts of stuff. But I thought I would just pull up 4 bullet points that focus on some of the funded research that he's doing. And so Dr. Semenza's team has been leading a pilot study funded by the South Jersey Institute for Population Health, where they're studying the healthcare needs and barriers of violently injured Black men in Camden. He's also part of a team that about a year or so ago got a $1.5 million grant from the Bureau of Justice Assistance, and that team's implementing a 3 county-wide community violence intervention program in South Jersey. He is co-investigator of a grant funded by the Office of the Vice Provost for Research. The PI is Dr. Jessica Hamilton over in psychology at Rutgers, and they're looking at the relationship between social media exposure on gun violence and adolescent mental health. And then actually just, I think, 2-3 days ago, he got word that he is PI on a newly funded grant from the National Science Foundation, NSF, that is building off some work that we funded for him a couple of years ago, where they're developing a large data set examining long-term physical and mental health consequences for survivors of gunshot wounds. So very active on that side of the shop. And so I wanted to highlight that, the work that he's doing, and hopefully next year he'll be a huge part of this event. I also wanted to take a second and quickly highlight some of the external funding that we have independent of that as well. A lot of the work I do is military focused. You'll see that in the results I'm going to show you in a second. And so subsequently, that's where a lot of our funding comes from. We have a grant from Henry Jackson Foundation that is allowing us to train 5 or 6 states, the National Guard in those states, in how to implement a intervention called Project Safeguard that we have led the way on. That is a form of lethal means counseling, talking in this case to service members about how to securely store their firearms. We have another grant from the Department of Army. In this case, we are really just co-investigators on one study from a larger grant where my friend and colleague Craig Bryan is the main guy. And in this particular project that we're helping out with, we're looking to see whether that same Project Safeguard intervention is improved if we also supplement it with an intervention that helps folks be more tolerant of uncertainty. So if we can make people more tolerant of that, are they more receptive to conversations about storing firearms securely? And you'll see we have several other Department of Defense grants, in which those grants, what we're doing is, again, adapting Project Safeguard and trying to, in this case, train other folks to be able to administer the intervention so that a lot of different people have these tools in their tool belts, and service members then have a lot of opportunities to sort of have the conversation about secure storage be normalized and more frequent. And the last thing you have to see listed on here is some funding we have from the New Jersey Department of Human Services Division of Mental Health and Addiction Services. And what they're doing is funding us to build up a map that we built, as the New Jersey Firearm Storage Map, which you can find on the GVRC's website. And what these maps are maps that are freely available. They exist in several states, and they list in our case, firearm retailers, FFLs, that are willing to consider on a case-by-case basis storing individuals' personal firearms away from their homes on the site of the retailer temporarily. Now, sometimes because someone's feeling suicidal, but just because they're going on vacation or all sorts of reasons. But if the idea is part of secure storage involves getting the firearm out of the home at certain times, we need to make that easy and legal and viable option for Jersey residents. And some of the funding we have now is to build this map up and then disseminate it so firearm owners are aware of it as a resource. But what I want to do with the bulk of my time, and I'm going to keep an eye on the clock, but I want to walk you through a bunch of sort of key findings from our publications and a selection of our publications. And again, I'll emphasize these are coming from the sort of suicide prevention side of our shop. They don't represent the entirety of our work, but this is the work that I'm a little bit more well-versed in. And you'll see as I talk through this, I'm going to present you guys a whole bunch of visual abstracts. And each visual abstract has a lot of information on it. I mentioned these during my opening remarks. Anytime you get a publication, I don't want it to end there in a journal. I want that information to get out. So Patrice and our comms side and some of our students, Ali Bond, Shelby Bandel, Taylor Rodriguez, they help us create visual abstracts that summarize those results. I'm going to place those slides up or those visual abstracts up as I am presenting on some of those studies. Don't worry about trying to get all that information in all at once. If you want to get any of these visual abstracts and actually read more of the detail, you can go to our website, so Gun Violence Research Center.rutgers.edu, or you can go to our Twitter handle at NJGVRC and just click on the media tab, and you'll be able to find all of those abstracts there. They're intended to be free, and we want people to share them. But let's talk now with the sort of limited time I have. I'm going to try to do this in about 12 minutes, 15 minutes, so I leave time for Q&A. But I want to talk a little bit about firearms and suicide and some of the work we've done on how to promote secure firearm storage, particularly within the context of a huge firearm purchasing surge that's taken place over the last few years. And so some of the basic stats that are worth being aware of is that of the 48,000 or so suicide deaths in the United States in 2021, 55% of those deaths were by self-inflicted gunshot wounds. And that's true despite the fact that firearms are used in less than 5% of all suicide attempts. And the reason you see that, this idea that when someone attempts suicide in the United States, they almost never use a firearm. But if someone dies by suicide in the United States, they almost always use a firearm, or more than often than not, they do, is because of the uniquely high case fatality rate. Firearms are more deadly than other methods. So 85 to 95% of the time someone uses a firearm in a suicide attempt, they die. Less than 5% of all suicide attempts by other methods combined are lethal. Now, some methods are closer to firearms than others, hanging, for instance, but none of them really approach the sheer lethality, the sheer deadliness of firearms. And the reason that's, well, I'll come back to that point actually in a second, but it's also worth noting, and Dr. Ramshad touched on these points in his keynote earlier, we know that suicide is up to 5 times more common in homes with firearms, and that the risk extends to everybody inside that home, not just the firearm owner, him or herself. And that on average, folks have owned firearms for 10 years or more before they use them in a suicide attempt. And so that means that it isn't all about what happens at the point of purchase. It's about making sure the home environment is safe so that the firearm owner and his or her loved ones are not at risk, or even more risk than they need to be in difficult moments. And the point of that is that risk increases even further when a firearm is stored unsecured. And again, from a suicide prevention perspective, when I'm talking about secure firearm storage, I'm talking about unloaded, separate from ammunition, locked up in a locked location like a gun safe or a lockbox, or at least with some sort of locking device installed, a trigger lock, a cable lock, a clamshell case. Now, I mentioned the sheer lethality of firearms, and what's particularly tragic about that is that there's pretty compelling data showing that around 70% of folks who survive a suicide attempt never go on to attempt suicide again. And what that tells us is that second chances matter a lot. But if firearms cause death 85 to 95% of the time they're used in a suicide attempt, that means that folks who use a firearm in a suicide attempt almost never get that second chance. So they don't get to be a part of that 70%. So a lot of my work is focused on figuring out not how can we get people to die by suicide using some other method. Firearm suicides aren't more tragic than other methods, but it's how can we get folks to be less likely to reach for a firearm in a moment of distress? Because if I can lower the odds that they do that, the odds that they survive, that we then have a chance to help them sort of build the life worth living that they deserve, they go up dramatically. And so we do this through secure firearm storage. And what I want to do is walk you through some ideas we have about how we can best promote secure firearm storage amongst firearm owners. And I want to lead with actually a finding from a study last year led by one of our students, Ali Bond, who found a lot of things, but in a sample of almost 250,000 folks who died by suicide over a 15-year period in the United States, what she found is that folks who die by suicide using a firearm are less likely to have been in mental or behavioral health care at the time of their death or any other time before. So what that tells us is that the folks who are dying by suicide using a firearm aren't coming in and seeking help from us. They're not asking for help in traditional channels. And so that means, man, our solutions probably can't just be housed in the mental health care system or the healthcare system overall. But taking that a step further, in a study that we published just a couple of months ago, what we found is that when we do think about this in the context of the healthcare system, there's some problems there too. Actually, in our sample that was drawn from 5 different states, Colorado, Mississippi, Minnesota, New Jersey, and Texas, we found that less than 1 in 5 folks overall have ever been asked by a healthcare provider whether they have access to a firearm. It's slightly higher amongst firearm owners, but not much. And what we found furthermore is that when it does happen, when clinicians ask, it's usually within the context of a mental health situation. So that's good. That is a good time to ask. But remember, if folks who die by suicide using a firearm are less likely to come into mental health care, we might not be seeing the right people there. But it's also happening amongst white men more often than it's happening amongst other folks. And certainly white men own firearms more than other folks. But if you look at the data, that's changing quite a bit, pretty rapidly. And so if folks are sort of asking the folks they think own firearms, they're guessing. And they're guessing in a way that sort of disproportionately underrepresents groups who need help just as much as anyone else. So thinking more about why we need to take firearm storage promotion, secure firearm storage promotion outside of the healthcare system, or at least not keep it housed there exclusively, we conducted a study we published a couple of months ago in which we had a national sample of firearm owning service members across branches. So in this case, every service member owns a firearm. Then we focused specifically on the 180 who said they'd had suicidal thoughts in the past year, and the 85 who said they'd had suicidal thoughts in the past month alone. And what we found is that amongst these folks who had suicidal thoughts, who have firearms, and who serve in the military, the ones who had hidden their suicidal thoughts from others, they hadn't told anyone else, were more likely to store their firearms unsecured. And the folks who had never sought behavioral or mental health care in the previous few months were more likely to be storing their firearms unsecurely. So what that tells us is, again, folks who are at most risk of dying by firearm suicide aren't coming into the healthcare system. And in fact, the ones who are hiding it the most by not engaging with care and not telling anyone about their thoughts are the ones most likely to be storing their firearms unsecured and readily accessible. So that means the people most at risk are sort of hidden in the community amongst us. And we have to figure out, okay, well, how can we possibly reach these folks who don't know who folks are, and they don't necessarily want to come in and talk to us? How can we get the idea to take hold that secure firearm storage is important? Well, one of the things we've tried to do to sort of get at this is just, first of all, better understand, what do firearm owners want? A lot of our programs focus on providing free access to cable locks, which come with many legal firearm purchases. And if you don't know, cable locks look a lot sort of like a bike lock. They loop through, depending on the type of firearm you're on, different parts of the firearm, but they essentially render it impossible to discharge ammunition while it's installed. But what we found in a national survey of firearm owners is that almost no firearm owners list those keyed cable locks as the type of storage device they want. What folks really want are, for instance, gun safes, whether those are biometric safes or safes locked with key codes, or they'd be interested in coupons that allow them to have a discounted access but free choice of the type of device that they want. And so what this study tells us is that there's a mismatch between what firearm owners are saying they want and what at least suicide prevention folks are saying they'll give them. And that's not great, right? When the market's saying, we want this over here and you're offering this over here, you guys, your paths aren't crossing. And it makes it, again, very difficult for us to offer a tool that's likely to actually have the result that we want. So we followed this up with that same exact national sample of firearm owners, and we asked them a few things. And you can see on this, and you can download later, what firearm owners said they typically use in terms of storage devices. But what I wanted to highlight here are what firearm owners told us would in fact motivate secure storage or get in the way of it. And what firearm owners told us again and again is that, look, I would consider locking a firearm up to prevent access from children or adolescents, or to prevent someone from stealing my firearm. But what firearm owners also told us is that for the folks who weren't using locks, the reason why are, first of all, A, they don't think they're needed, which means we're not getting the message out about the utility of locking firearms up. Or they say, look, I get it, but they also get in the way in case of I need quick access in emergency, which goes back to what Dr. Ramshad was saying about the disconnect between the perceived likelihood of someone breaking your home and hurting you and you needing to successfully use defensive firearm ownership versus the likelihood that that firearm is going to result in a suicide or unintentional death in your home. But I don't want to dismiss cable locks entirely, right? Even if they're not the most effective storage device or the most wanted device, they're cheap. They're readily available. A lot of firearm owners already have them, just aren't using them. So I still want to take any tool available to increase the odds that someone's going to lock their firearm up in some way or another. And what we found in a study looking amongst firearm owners, again, in this case, across 2 different samples drawn from the different parts of the country, is that the percentage of time that firearm owners were told at the point of purchase about locking devices that came with their purchase, the more frequently that happened during their firearm purchases, the more likely that they actually use the lock now. And what that tells me is that dropping a lock in a bag and not saying anything about it doesn't necessarily encourage anyone to use it. And in fact, we have some data that we'll hopefully present pretty soon that demonstrates also there's a knowledge gap in how to properly use these devices. And so it might be as simple as having effective, useful conversations might normalize the use of these devices. So I want to take a couple more minutes to talk just about a couple of things that, again, I'm keeping an eye on a clock to make sure that we stop by at least 11:55 on this. But in thinking about how to reach folks, knowing that it can't be entirely restricted to a psychologist's office or a hospital visit or people coming in for their wellness visit, there has to be a way to get the message out and normalize it. We spend a lot of time thinking about means safety messaging. Means safety is just a term we use that talks about taking a method for suicide and either making it less deadly or less available. And so I'm talking about public health messaging. So think about what we did with drunk driving. Friends don't let friends drive drunk. Things where you have a sort of public narrative that tries to encourage a shift in behavior. And so we spent a lot of time studying who are the folks who firearm owners want to hear from? What are the voices that would be most effective? What are the channels through which that message needs to be delivered? And what needs to be contained in the messages that are sent about? And what we found through a lot of survey work is that certain voices are really trusted quite a bit. For instance, law enforcement, service members and veterans. Other voices less so, celebrities, or much to the chagrin of many of my colleagues, medical professionals. It's just not the face of the franchise. Doesn't mean that medical professionals shouldn't discuss with their patients, but there's difference between having a clinical interaction with your patient and being a public face of a movement promoting an action. And so the take home from a lot of this is that it sounds like the message needs to come from within the community, not to the community, especially in such a polarized, politicized issue like firearms. And so we've published a study, again, using that national sample of firearm owning military service members. And what we did is we randomized them to see one of 12 different visual messages on secure firearm storage. And they were all pretty much the same visual. And you see it right there, the service member storing a firearm in an armory. But we varied what we said the profession was. In this case, the service members from the Air Force, we used security forces, which is akin to law enforcement. We said a primary care physician, or we said an individual is more a combat controller, so more of a special forces type position where there's a lot of potential training with firearms. Then we varied what was in the message and a few other things. But what we found, and I'm skipping ahead a little bit here because I want to save time for the last thing, was pretty complicated. But there are 2 things that stuck out. Whatever it said in the message, and we varied again a few things, and I can talk about that more if people want later, but whatever was in the message, if the message was voiced by security forces, so again, law enforcement, we got very positive responses. So from immediately before to immediately after, firearm owners sort of shifted their sense of how willing they are to use a bunch of specific in-home in particular, but also out-of-home storage practices. What we also found was sort of regardless of what messenger or message you're looking at, we saw the most consistent willingness to adopt changes in using locking devices like cable locks and trigger locks, which surprises me, but I think also just might speak to the fact that people are more willing to use the thing they already have in the moment. But if that message also came with sort of easier access to acquire a safe, I still think firearm owners would prefer that. So what's the general take home? we need to package the message of secure firearm storage correctly. We need that message to be delivered by trusted voices, credible messengers through trusted channels. Otherwise, no matter how data-driven it is, no matter how authentically we feel the importance of it is, it's going to feel like an outsider, and the message is not going to be persuasive. And what matters is the message being persuasive, not my voice or anyone else's voice like mine being the voice behind it. So I want to take a minute to talk about the firearm purchasing surge and one study we've done this year related to this, and then I'm going to sort of pause and Thurman's going to come back and we'll do a little bit of Q&A. But for folks who don't know, prior to 2020, there were already more firearms than people in the United States. And I know Dr. Roshan gave this number as well earlier, that upper estimates are that there's around 400 million firearms privately owned in circulation across the country. And the beginning in early 2020, what happened is that we saw an unprecedented surge in sales of firearms. And we published some data in a couple of studies in the last couple of years, and I presented on them last year, showing that firearm owners who purchased during this time were more likely to have suicidal thoughts than anyone else. I don't need to replicate that here, but what I want to say is really quickly on this one study with just 2 slides, and then we'll call it, is that we collected data from a few different states, and we looked at whether we could group people together based on their political beliefs and behaviors and their general health behaviors, the ways they defend themselves from illness. This was in early 2021 before COVID vaccines are readily available. So we were looking at, do you intend to get a COVID vaccine? Do you wear masks? Do you generally get the flu shot, which is not a politicized health behavior? And what we found is we had 4 groups broken down by political beliefs and health behaviors. We had folks who endorsed liberal beliefs and engaged in lots of health behaviors. They got masks, they're going to get the vaccine, they get the flu shot every year. You had folks with moderate political beliefs who do very few of those health behaviors. You had folks with conservative beliefs who, again, do lots of these health behaviors. So again, masking up, going to get vaccine, get the flu shot every year. And then you had a group of folks who endorse conservative beliefs and do very few of the health behaviors. And what we found is that the 2 groups that said they don't do many of the health behaviors, they also were more likely to purchase firearms during that purchasing surge. So what we see is a disconnect. Folks don't see a lot of threat from physical illness, and they're not going to take up a lot of these public health recommendations, but they do see threat in the environment more broadly, and they purchase firearms as a tool to avert that threat. And so you have a bunch of different groups of folks who are making different types of risk calculations. Why do they make those calculations? Well, one thought we have that's backed up by our data here is that the folks who were more likely to purchase firearms and less likely to use these health behaviors endorse less belief in scientists as having the public's interest in good. And so that the take-home message here, and I led with this in my intro, is that scientists and data often are not the trusted voice. And so it's beholden upon us to make data be part of the conversation, to be trusted, so that people can make risk calculations that are backed by data and that can encourage healthier choices. So my contact information is up there. I'm happy to take questions down the road, but if Thurman wants to pop on, I think we've got about 5 minutes, and then I promise we won't steal anybody's lunchtime.
Probably a little longer than 5 minutes. You landed the plane up just a little early. We have a question from the audience from Frank Plunkett. Want to thank Frank for being here. He's asked a number of thoughtful questions this morning. Does the data show a significant effect of safe storage versus suicide for the gun owners who have access? In other words, I can pick up my gun so family members, I can lock up my gun so family members can't get access to them, but I still can while delayed briefly.
Yeah, so it's a really important question, and it's a tricky one, right? So to design a study, I'd have to follow millions of people over years to see whether when someone made a change, that changed something, right? So what we have is a bunch of data that dances around that. So if you compare firearm owners who died by suicide, the ones who died by using their firearm are more likely to have stored their firearm unsecured. If you look at households where firearms are stored unsecured over time, the likelihood of suicide death for anyone in that home are substantially higher than in homes where there are firearms stored securely. So you see a number of things that point to the idea that will work. But like you said, a firearm in the home that you yourself can access really quickly still is a threat, right? You can neutralize the threat for your children or your partner or your roommate, but you could still get to it. Now, I think people underestimate how difficult suicide is and how having a simple barrier in place can be all you need to make someone stop doing this thing. But you're right, it doesn't bring the chance down to zero. And that's why we have things like the firearm storage map, where it says, look, if you yourself, the firearm owner, are in a moment of difficulty and you're thinking, I know this is locked up, but I also know how to unlock and I can get to it. That's a moment to think, maybe this is a time to temporarily store it outside my home. The same way you let someone hold your keys if you had too much to drink, then you go get it back, right? And so, yes, it would be better if secure storage extended outside the home and the firearm owner, him or herself, is having a hard time. But I do believe the data supports the idea that secure storage in the home is at least better than unsecure storage in the home.
So we have another question from Joan M. I'm going to say M because I don't want to butcher her last name. It's really about safe guns. Is there any other work going on for other forms of safe storage, such as fingerprints or facial recognition or password?
Yeah. So when you're talking about fingerprints, that could apply to the storage device, so like a biometric, safe, or lockbox, or it can apply to the firearm itself, so a smart gun, like Thurman was just saying. There's not a ton of data to show to what extent those particular forms are more or less effective than the sort of less sort of technologically savvy approaches. The research that's out there so far on these sort of biometrics, yet at the has actually mostly looked at concerns that some firearm owners have expressed that the technology will fail when they need it. So when we've asked firearm owners, hey, are you open to a biometric safe that would get you pretty quick access as opposed to having it out on your bedside table? Some folks have said, well, but what if I need it? I put my fingerprint, it reads my fingerprint wrong. There's no evidence to say that would happen, but the only data that's out there so far on these sort of more technologically savvy approaches, again, whether it's the firearm itself or the storage device, is looking at the sort of perspective of the firearm owners in terms of willingness to engage with the technology.
I have a question from Karen Cantor, who's been with us for most of the morning. Is there liability concerns for those friends who store a gun for a friend?
So liability can mean a lot of things, and it's a great question. And I will also, again, tie this back to the map in a second. So look, there can be, look, if first of all, in New Jersey, you can't just hand your firearm over to a friend. That's a temporary transfer of fire. Like, you have to do a background check. There's more official than that. Where I lived in Mississippi, there was less regulation over transfer of firearm. If someone wants to give something to a friend, what they need to do is disassemble the firearm, let them hold the firing pin, for instance. That's not transferring a firearm. So that would be a way you could avoid liabilities. Don't transfer a full firearm. Render the firearm temporarily inoperable by giving a piece of the firearm to someone. That then addresses sort of the liability concern. The liability would be, what if that individual loses the firearm? Could they be sued by the firearm owner? Or what if something bad happens with that firearm while they're holding it? Or when they give the firearm back to the firearm owner, that firearm owner that used it against themselves or someone else, could they be held liable? It's an open question, right? There's not clear law that will happen in those latter out things, but I know that a lot of states are working to avoid that very thing, right? If we're asking people, including in New Jersey, retailers to hold firearms for people in moments of distress, we need to take that liability concern off the table. Otherwise, they're having to put their business on the line. Now, there's no reason to think these businesses will be sued, but what I'd like to see is for that to be codified. And some states like Louisiana actually have done that. And so a conversation I intend to have with lawmakers in New Jersey is trying to find ways to ensure that when folks engage in positive public health behaviors, like holding a firearm for someone who's in a difficult moment, they aren't then sued for taking part in the public good, because there's no way for them to know when the right time is to get the firearm back. All they can do is their best.
Great talk, Mike, as usual, man. We're at our time. I want to make sure I make this announcement really clear. We are breaking for lunch for 30 minutes. So this was a hard stop, but we're also going to have I don't know if such thing as a hard start exists, but we're asking everybody to be back at 12:30. There'll be an announcement about the breakout rooms that you don't want to miss. So please be back by 12:30.